Welcome to rePROs Fight Back, a podcast on all things related to sexual and reproductive health rights and justice. Hi, rePROs. How's everybody doing? I'm your host, Jenny Wetter, and my pronouns are she, her. So y'all, I don't know how it became April all of a sudden. It snuck up on me, and it's just... And I know April showers bring May flowers and all that, but man, it has been raining here for several days in DC, and I would like to see the blue sky again, feeling a little bleh. But, these things happen. But what I do have to mention is there was a really exciting report that came out with the overall organization I work for, the Population Institute, done by two amazing colleagues of mine, Maniza Habib and Amani Nelson. Y'all, this report is gorgeous. They did an outstanding job. I can't wait for one or both of them to come on the podcast and talk about it. It's called Behind Closed Doors, and it looks at gender-based practices in the United States. So it really tackles the misperception that a lot of things like child marriage and FGM and femicide occur only in other countries. And so it takes a closer look at those things in the United States. And it's just it's a beautiful report. The artwork is gorgeous. It's wonderful to look at, but they did such an amazing job, and y'all should definitely check it out. We'll make sure to include a link to it in the show notes for you to check out. But yeah, highly, highly recommend checking out Behind Closed Doors. And just huge congratulations to Maniza and Amani. It is a wonderful report. Great job, y'all. And with that, I think we're just going to turn to this week's interview. It was a little longer again, not as long as last week's, but a little longer and just amazing. I'm so lucky to have had some amazing guests back to back. So this week, we are talking to the wonderful Dr. Monica McLemore, and she's with the University of Washington School of Nursing. It's a wonderful, kind of far-ranging conversation, but we're doing it in honor of Black Maternal Health Week, which starts later this week on April 11th. And we'll make sure to include the toolkit of ways you can participate in Black Maternal Health Week in the show notes as well, because there are a lot of ways that you can take part and actions you can take over the next week, kicking off on April 11th. So make sure to check that out. And with that, let's go to my interview with Monica. Hi, Monica. Thank you so much for being here today.
Hey, I'm so glad I get a chance to finally record this and talk to you.
I know. Before we get started, do you want to take a quick second and introduce yourself and include your pronouns?
Oh, yeah, absolutely. So I'm Monica McLemore. I use she and her pronouns. They and them is fine, and doctor is okay too. I am currently professor in child, family, and population health nursing at the University of Washington. And I serve as the director for the Manning Price Spratlen Center for Anti-Racism and Equity in Nursing. I have adjunct appointments in the School of Public Health and Gender, Women, and Sexuality Studies, all at the University of Washington.
I'm so excited to have you here. I've been following your work for a long time and following you on social for a long time and have learned so much over the course of that. So very excited to have you here to share your wisdom.
Well, I'm glad to be here. And I want to make sure people know, I am myself on all socials except for the one formerly known as Twitter. I left Twitter on my birthday. I was so mad. I was in New York City. Yeah, well, I was, I had like 40, 50,000 followers. I had to download my archive. But it's just become so toxic that I just decided I don't need that in my life. So, but I'm on everything else. I'm on Threads, Facebook, Instagram, LinkedIn, YouTube. I'm my TikTok. I'm myself everywhere at McLemore MR.
Awesome. Well, I feel like it's been a while since we've talked about Black maternal health on the podcast. So I thought maybe we should do like a little bit of a quick overview before we get too deep into it
we should start with that
a little history, right?
We should start with that anyway, because it's almost Black Maternal Health Awareness Week. So for the people who don't know, Black Maternal Health Awareness Week was started around Easter/Mother's Day to really be able to raise awareness around the maternal morbidity and mortality crisis in the United States. It's April 11th through April 18th, and you'll see all sorts of activities and webinars, symposia. And what it was really meant to do was when the Centers for Disease Control and Prevention finally decided to go back to counting maternal deaths, because, the way that pregnant, capable people and people with reproductive capacity get treated in our country is really shameful in terms of not just clinical care that people receive, but even how we count people in science. So annoying. Anyway, in 2017, the Centers for Disease Control and Prevention decided to again start to count maternal deaths in the United States. And what we found out is that regardless of race and ethnicity, our maternal morbidity and mortality statistics were increasing, right? And so I always like to tell people that, we are in a situation where between 1,275 and 1,400 maternal deaths happen every year in the United States. It is still considered a rare event since we have, 3.6 to 4 million births per year. But the significance around the statistics of this rare event is it's primarily born on the backs of Black and brown people. When we first figured out that Black women were 4 times more likely to die from pregnancy-related complications, and these are preventable pregnancy-related complications, the alarms went off. And so we started Black Maternal Health Awareness Week, the Black Mamas Matter Alliance, and the Black Maternal Caucus within the Congress and the Senate to raise awareness and to hopefully be able to pass some legislation that would allow for us to improve health outcomes across the board. This shouldn't have been surprising to people because in the United States, we've seen maternal morbidity and mortality increasing regardless of race or ethnicity. And it really has to do with several factors that are very complicated, right? Number one, and this was before forced birth and fall of Roe and land of Dobbs, like before all this, we were having issues. And if you would have left it up to the medical industrial complex, of which I've been part of my entire adult life, you would think it was pregnant people's fault that they was dying from their own deaths. The language in the research literature, they were looking at, are people coming to pregnancy older? Are they coming to pregnancy sicker? Are they coming to pregnancy fatter? Are they coming to pregnancy, uninformed, unprepared? Like, you would think people were responsible for their own deaths. And I was just about done. So I really shifted some of my work in 2015, 2016, 2017, really trying to get people to understand that, no, these are systems problems, how people are being treated, not listened to, not believed, disrespected, the whole 9 yards. And then we got a huge amount of help from the media. Nina Martin and Renee Montagne. So Nina Martin was at ProPublica and Renee Montagne was at NPR at the time, and they both retired, but they were doing a journal project called the Lost Mothers Series, where they were trying to really document maternal deaths in the United States. Then we got help from Vogue because Serena Williams told her birth story January of 2018, and then Beyonce turned around in September and told her story. So we had also, me and my research group and a whole lot of other people had also been trying to look at what was the root cause of why we were seeing so much maternal death. And it really had to do with teams being in conflict, not believing folks. And then poor, Dr. Shalom Irving died, and she was at the CDC running the maternal morbidity and mortality programs, right? Preventable maternal death. So and we can fix this. That's the other thing, right? Throughout this entire conversation, the main thread is going to be in reproductive health rights and justice. Number one, I'm glad we're getting the kind of attention that we're getting. Number two, welcome to those of you who have not been around. Number three, if we wanted to fix this, we could, right? I've already alluded to the ridiculousness of the Dobbs leak and the overturning of Roe and all that weirdness, right? Okay, Congress could have fixed this. They still can. And so if we decided we had enough votes and wanted to be able to pass the Women's Reproductive Health Protection Act, then we could actually fix all this right now. We could restore some of the protections of Roe, including not criminalizing pregnant people for their outcomes, not criminalizing those of us who are trying to take care of them, right? So everything, like that's the through line of everything I'm going to say. If we wanted a different future, we can make decisions now to make sure everything we want to do is different in the future. I'm not going to be your doom and gloom guest. I'm not going to sit on here and talk about my fear and how scared I am, because that's just not true, right? We can fix all of this if we really had two things. Number one, the political will that's necessary in order to be able to make legislative change, because we saw the non-bipartisan, Alabama Congress and Senate come together in 10 days to have a bipartisan bill about IVF, right? That can happen. And they hadn't had a bipartisan bill in 20 years. So I'm just about done when people tell us, we need the right leverage. So number one, we need the right political will in order to be able to twist the right arms of the right people to get the kind of legislation that we want. And then we need litigation. We got to sue the hell out of everybody. It's one of the reasons why I'm one of the expert witnesses in a lot of the cases around the country, whether it's to expand midwifery practice or to sign on and allow for decriminalization of midwifery, or to expand abortion access in states where it's not banned, because we can fix this.
I think it's so important. So often these conversations happen in silos. And this is the great thing about reproductive justice, is it brings it all together. Like maternal health and abortion are the same conversation.
Yeah.
And we talked about, how the U.S.'s maternal mortality rate is increasing. That is putting them out of step with the rest of the world, particularly in other developed countries. And that's the same thing with abortion rights. We are one of only 4 countries that has restricted them in the last 30 years. So again, these are very much the same problem.
Well, okay, so now that you done brought that up, I need to, make sure your readers or the listeners understand. This is the 30-year anniversary of reproductive justice, right? And if you are not familiar with the framework, it's very important that you completely understand it's a very different way of talking about the reproductive health trajectory and rights that citizens should be able to expect, because it's grounded in human rights. So let me break this down for the listeners, because sometimes people miss this, right? Folks forget in the United States that our origin story matters in terms of how we got where we currently are. So number one, we have negative rights as citizens because we were fleeing a monarchy. Let's remember that, okay? So we don't ground our rights as citizens in human rights, because the way our Constitution is written, we were trying to flee a monarchy. So we're free from control of a state. We're free from, right? Okay. So reproductive justice was conceptualized in 1994 in Chicago by 12 Black women who came together and really thought that the pro-choice frame was too limiting, specifically in the context of their lives. And if you don't know anything about reproductive justice, I'm going to give you the resources of the names of the people who started it, because my understanding, all but one are still alive. And many are people that we know and love, like Dr. Tony Bond or Dr. Loretta, or soon to be Dr. Loretta Ross, right? I mean, we got MacArthur Genius Award winners and faculty members. And so anyway, they conceptualized that. And they talk about it more simply than I do. So when RJ founders talk about reproductive justice, they say it encompasses this notion that you have a human right to have a child, to not have a child, and to parent the children that you have in safe and healthy environments with all the supports that you need in order to be successful. That's the way they talk about it, right? The way I talk about it is because I use it not only as an organizing frame and an advocacy tool, a strategy, as well as a research theory. I talk about it as reproductive justice affords every citizen the human right to make family and kin, and to birth in whatever way they see fit, with all the supports and dignity that they need to be able to do so. Those same citizens have the human right to prevent and or end pregnancies with all of the supports that they need to be able to do that with dignity in the ways that they see fit. Those same humans have the human right to parent the children they already have, free from violence of any individual, state, or government, And they have the right to disassociate, the human right to disassociate sex from reproduction so that we can have conversations about healthy sexuality, consent, pleasure, and being whole human beings as sexual and or asexual entities.
I love that. I love that description.
Yeah, because for me, I'm tired of we need to call a thing a thing. So, listeners, this is going to be very upsetting to you. It's kind of like in the Matrix, but we have been lied to for the last, I don't know, I would say 400 years, but specifically for the purposes of this conversation, we've been lied to for the last 50 years, right? 50 years plus, because we have been told that there are only two sides in conversations about sex and sexuality. You are either pro-life or pro-choice and anti-abortion. And quite frankly, that is a lie, right? It is complicated. I'm not the only research group. A whole lot of other people have looked at this as well. It's messy. And people's thoughts and feelings about abortion, whether you're a healthcare provider or you're a member of the public, are complicated. Why? Because the propagation of the human species is complicated. You talking about intimacy with another human. You talk about religion. You talk about family and transgenerational stuff. You talking about whether or not you even want to be a parent, whether or not you even want to be like a sexual person. We still live in a society where people figure out their sexual orientation by trial and error. So that's a problem. Like, it's all a mess. It's messy, right? And human beings are resilient. That's the other thing. Right? Even if you do end up in a situation where you don't know you want to be a parent, and you're in a situation where you got to make a decision about being a parent, most people will figure that out. We saw that in turn-away study, right? When people are denied wanted abortions, they somehow figure it out, right? So it's messy. And those are not legally prudent arguments, but they're real human and scientific ones. And I'm so tired of lawyers and judges inappropriately and inaccurately trying to reduce this conversation to something very simple and very basic when it is not. So that's why reproductive justice is very helpful. Let me give you some examples. Number one, the right to make family and kin in whatever ways see fit and to birth under situations and circumstances. That means you can have a home birth and a midwife and not be criminalized. But midwifery is currently criminalized in the state of Alabama, right? Or the right to end pregnancies with all the supports that you need and dignity, then we wouldn't be criminalizing self-managed abortion. Or people who have miscarriages at home, having to have grand juries and stuff. Hello, Brittany Watts, right? Or to parent the children that you already have, free from violence. Okay, hello, Haiti, Sudan, Gaza, Palestine. Or how about you shouldn't have to relinquish your parental rights because you're disabled and you actually want to get married and be in love and start a family? Or how about you shouldn't have to relinquish your parental rights just because you might have committed a crime? So it widens the frame, it widens the aperture. Or how about you should be able to have the gender affirming care that you need in order to operationalize your whole, not only reproductive trajectory, but your whole existential being. How about that? But this notion that we get to allow theocracies to tell us what we can and can't do, that is a lie. So as far as I'm concerned, the power of reproductive justice is it blows apart the false binaries that we've been lied to about for the last 50 years, that there's only two sides of something. There are multiple sides of things. And in my mind, if you serve the public or you're a member of the health professions or you're a public health practitioner, the only side that really matters is the person sitting in front of you that we're trying to serve. So I get real irritated when people, when I hear anti-abortion talking points or when I hear theocracy-driven, very novice understandings of the complexity of human sexuality, or when I see manuscripts that have been retracted because of conflicts of interest being cited in the Supreme Court of the United States like evidence, I get very angry about stuff like this. Because we've been intellectually lazy and we've been lied to for the last 50 years.
This just makes me think of all the current myths and disinformation that is floating around.
Let's get on it.
Around reproductive health, man. It's real bad right now.
Well, again, I mean, not only is misinformation and disinformation part of that 50-year lie, it also is part of the erasure of history. That's why the origin story is so important, right? Like when I teach students, I always have to remind them that when the illegal importing of enslaved persons ended in the United States, that was not the end of enslavement in the United States. People never think about the fact that enslaved persons inherited the status of their mother, not their father, their mother. If you were enslaved and you were a slave person who had been sexually assaulted / raped by the person who was enslaving you, because consent is not possible in the context of slavery, then that means your offspring, your progeny, who are citizens, inherit your social status. We bred more enslaved persons because we could no longer import them here. So when people always talk about why is the reproductive health of Black women so complicated, look at the origin story. Then you look at the workforce that has surrounded them, right? People always ask me why I do so much work around the discrediting of the grand midwives, and I want to see more Black midwifery. It's because we birthed the whole nation. We used to take care of everybody before Shepherd County in 1921, when the grand midwives were discredited. And then they stopped taking care of everybody because we were trying to professionalize obstetrics. So they used, abortionists and all sorts of other, untrue and deeply stigmatizing language to call them uncredentialed and dirty and unprofessional. So misinformation and disinformation is part of the larger scheme. That's why we can't have comprehensive sex education in schools, because it's misinformation and disinformation. They want that to run rampant so that nobody actually knows the physiological responses, the accurate scientific terms for body parts and biology. This is all purposive, right? If you have plausible deniability about the truth, then you can tell anybody anything and they might believe you.
Oh, yeah.
Right?
Sex ed from a nun definitely learned birth control didn't work. Condoms didn't work.
Right.
How is that helpful?
Right. And the other thing that I think also that we're going to have to reckon with that I think is hella problematic is the supremacy of Judeo-Christianism, right? I work as a nurse, right? And the idea that we have so much consolidation of our health services and health systems. Normally I'd be talking to you from Washington State, where I actually live, currently in Philadelphia, Pennsylvania. But in Washington State, it's estimated that 1 in 4 hospital beds are run by religiously affiliated institutions. And so as we consolidate more and more, Dr. Lori Friedman's work has already taught us that 1 in 6 hospital beds in the United States is operated by religiously affiliated institutions.
And you might not know.
Then the majority of those are the Catholic Church, right? So if I'm Hindu and I happen to be a medical assistant and I work at a religiously affiliated institution as a medical assistant, that means my employer decides the cafeteria menu of options that I have available to me as an employee is part of my health insurance. That's part of why the EMTALA case is so important at the end of this month. So let's get on that.
Oh, good.
I am just about done with the Supreme Court case.
Oh, I'm really stressed about this one.
I didn't give a rat's ass about the Alliance for Hippocratic Medicine because I knew they ain't had no standings. And the justices actually read right through that too, right? Okay, because hypothetical harms are not eligible for then turning around and saying everybody else in the country can't do something because you might hypothetically be harmed, right? Okay, so let's just cut that one out. Okay, I felt very good after the oral arguments in that case. Okay, but this EMTALA situation is a problem. Okay, so for the people who don't know what EMTALA is, in 1984, we had an epidemic, and it was really spawned, interestingly enough, in my former home state of California, where we had a couple of medical malfeasance cases that went down. Some were in carceral systems in the jails. So like 3 incarcerated persons had died at like San Quentin. But then we had this whole other situation where we had patient dumping on Skid Row for unstably housed people in Los Angeles and greater Los Angeles area. Those medical malfeasance cases got heard by the Supreme Court of the United States. And what came out of that was a law, and I should probably look up what EMTALA means, and I'll do that at some point. But it is shortcut for being able to say that no person can be turned away from urgent care, emergency care, without being stabilized, regardless of their capacity or ability to pay. And this is a law that is being exploited in a case out of Idaho that is trying to overturn EMTALA on a conscience clause, basically saying that someone presents to an emergency department or urgent care under suspicion of a pregnancy ending, abortion, miscarriage, whatever, that people can evoke conscious claims and not have to care for those patients. And that the protections of EMTALA are going to be removed, not just for pregnant capable people, but more broadly. And the reason this is very frustrating and scary and, in my opinion, immoral is because, pregnancy's ending is always a time-sensitive decision, irrespective of how they're ending. Even birth is a time-sensitive decision, right? So there's decisions that need to be made around care for pregnancies that are ending regardless of how they end. And so this notion that we're going to have to parse who can take care of these people who can't in real time without just caring for people is frustrating.
And the next hospital might not be close.
Right. And it may not be close. And the truth of the matter is, the irony of all of this is like, we get gunshot wounds and criminals in the emergency department all the time, and we ain't trying to really parse like who shot you. Right? I remember when nurses got fired when the Boston Bombers got brought to the ED because they had the nerve to go on Good Morning America talking about they wasn't going to take care of them, which was a direct violation of the American Nurses Association Code of Ethics and our interpretive statement. Right? You're either innocent before proven guilty or not. We got due process or not. You don't parse that in the emergency room before we decide to take your bullet wound out. So you notice the irony that pregnancy's ending is the place we're starting. Like, I can't even. So I am real irritated. And that was one of the reasons why I signed on to the amicus brief of deans and scholars in the American Public Health Association and Robert Wood Johnson Foundation, a lot of other people explaining why EMTALA is such an important protection that citizens should expect to be able to save lives. So I'm real irritated by that whole situation, and that repro is the place, not gun violence, where crimes probably have been committed, right? I am just about done with people continuing to allow themselves to be lied to.
The thought of just turning someone away for needed care has always been one of those things that boggles my mind, that would be something that people would do.
And that's why I say, as a faculty member and somebody who admits students and reviews applications and packets, that we need to be more discerning of who is worthy of the gift to serve the public as a member of the health professions, right? Because if you want to get into healthcare to pick and choose who you want to take care of, maybe you need to do something else, because that's not how I was trained. That is not how I conceptualize the gift of being able to care for the public. And I'm not going to operationalize my personal beliefs around the care that they need, regardless of what it is.
It seems so basic. It just seems like the minimum.
Yeah, because I always tell people, when we say that you're on service, did you miss what the word service means? When we bring our students onto the ward, that is the exact language we use. I am on service this week. I don't know where people got it that healthcare would become ground zero for operationalizing or foisting your beliefs onto other people. I don't know where that came from, but that really needs to go away. I also think the other thing that has just sort of been driving me up a tree is the cruelty. And we need to call it that, right? I mean, I was in Alabama when Becerra visited, and, the whole Supreme Court came down with their decision because I was at the Mothers of Gynecology Monument and the annual meeting for Anarcha and Betsy and Lucy, right? That Dr. Michelle Browder puts forward every year. And the cruelty of saying to in vitro fertilization and assisted reproductive technology people that you don't have a human right to attempt to create family and kin, a basic biological function for some humans, right? You're not worthy enough as a human being or a parent. The cruelty of that, seriously? Or the cruelty of saying that we don't trust queer and trans youth to tell us who they are? That we are so controlling and so patriarchal that we're going to tell another person what their lived experience is? Like, we have been lied to, y'all. You don't have that kind of dominion over another sentient being. You just don't, right? We have bodily autonomy in life and death. At least now we do legally. No, when you die, nobody can go dig up your organs and take them without your written consent. So that this notion that we think in life we can tell people what they can and can't do is a real problem. And it's cruel. And we need to call it out as such. Because I will be damned if you're going to tell me what I, as a sentient being on this planet, can and cannot do, what risk I will or will not take on. I mean, when I think about the situation that young women are in right now, I always knew I wanted to be a childless by choice person. But we've known, people always, here's the other lie that listeners need to understand. Pregnancy is not without risk. In fact, we know that pregnancy is more risky, 14 times more risky in the most recent data we have than a first trimester abortion. Why? Oh, hello, you're growing a whole ass human. You are doubling your blood volume in 9 months. You are housing foreign DNA in your body. Under normal circumstances, your immune system would attack that and kill it. So how dare you walk around and act like there is no risk in pregnancy, but abortion is some big risky thing. Life is not without risk, listeners, and that includes pregnancy. So the idea that you would force pregnancy onto people, states where abortion is banned, when we already know that pregnancy, especially for Black women, can be very risky because we're more likely to die from pregnancy-related complications? Seriously?
And they all are the same states, right? The ones with the highest maternal mortality rate, the ones that have abortion ban, the ones with the most Black people. It's the same place. And banning gender-affirming care. Those are all the same states.
Yep. And in the same way, we have a clear understanding that the people who have births and the people who have abortions are not different people. They just at different time points in their lives. Well, the same states that won't expand Medicaid, the same states who have rural obstetric hospital closures because they didn't figure out that was the only way expanding Medicaid was going to be, that they would be able to stay open, since half the births in the United States are covered by Medicaid. There was nobody in the actuarial room that told them that. And now all of a sudden we have an even more exacerbated crisis in terms of our workforce, as well as places that actually serve people. This isn't some mystery out the sky that all of a sudden we don't have services, or that, those populations are underserved. These are policy decisions that people have made to continue to harm citizens. And it's because we've been lied to for the last 50 years, if not longer, right? That we don't deserve good care, that it's not possible to both work with the federal government and be able to get citizens what they need, right? Or that somehow we have to compromise, the economy for human rights, right? These are all lies. And we need to fire the people who keep lying to us. So at some point, I'm going to run for office. I said this on my Instagram live because I'm just about done of people who want jobs to represent folks when they're not doing their job of actually representing our interests. I'm done with that. Right? 6 physicians signed the Declaration of Independence. When people sit here and tell me that healthcare is not political, I'm like, okay, then why are we caring about SCOTUS making decisions in healthcare? Like, I need people to wake up and appreciate the fact that we have been lied to. The other place that we're being lied to is the public's not with us. Nobody should have been surprised when Kansas and Minnesota and Ohio codified abortion rights into their state constitutions and or defeated bills, right? Nobody should be surprised with it. Either you believe the Pew Charitable Trust polls and the Gannett polls and the KFF polls, or you didn't. Every time we've polled the public, they believe that a first trimester abortion should be available and accessible, and their acceptability for abortion goes down with gestational limit increases, which makes no sense to me because it's not like the outcome is any different, but okay. Right? Again, folk getting lied to. And the real truth of the matter is people don't like later abortion because they don't like it when people come late to anything. Late to prenatal care, late to dinner, whatever. People don't like folk who come late, right? That's just the thing. But let's not act like somehow the physiological outcome for the fetus is different, because it's not. So anyway, but this notion that we can't have a system of health care and social services that would allow for us to see better reproductive health outcomes is a lie. It would be helped along better if we had a robust social safety net. So to your point, the health outcomes of white people in the United States aren't even the best health outcomes we could get for white people in the world. Because when you look at other high-income countries, right, the white people in those countries get better health outcomes than the white people in this country, and it's not because they're homogeneous. Like when you look at the Swedens and the Norways and the Finlands and all that, it's not because they're European. You know why they get better health outcomes, the white people there? Because they have a robust social safety net. Immortality is not an option for our species. You either going to pay for it on the front end or the back end. You're going to have a dignified life and or dignified death. So you're either going to protect your citizens and help them be as healthy as possible with a robust social safety net. Oh, what do I mean by that? Paid family leave, like guaranteed coverage, right? People get their teeth fixed. They get their eyes checked when they have preventative health insurance coverage. We already knew that insurance coverage was the number one intervention to improve health outcomes at the population level. Why do y'all think we cover all kids? That families are not bankrupted because we agreed as a society that all children with serious illness would be covered by Medicaid. What do you think the Children's Health Insurance Program is, Chip? So don't act like, or even like Medicare and Medicaid. And people call them entitlements. Don't you think citizens should be entitled to some stuff? Entitlement is a word you use for a customer or consumer, not a citizen. So I'm just about done with people lying to us. I'm done. We need to call this shit out, and I need everybody to understand. Yeah, I'm entitled to some stuff. I'm a citizen. My ancestors came here and died for me to have the opportunity to make this world better. So yeah, but don't say entitlement like I'm some consumer asking for something I don't deserve.
And like that happened when they started painting it as programs that were going to Black and brown people, right?
Exactly. I just wish people would just say, like, I feel entitled because I'm a white person and I don't want to make any amends for what happened in history. Oh, and by the way, I don't really like Black people anyway. I believe every lie that I've been told about Black and brown and Latin and Asian people in the world. And I just wish people would be more honest about this kind of stuff as opposed to this fake, aspirational, harmful, colorblind weirdness.
Okay, this has been a really wide-ranging conversation, and I've loved every minute of it. But maybe let's talk real quick before we wrap up about what solutions, right? Like what?
Oh, yeah,
let's talk
this.
solutions. What can we do to fix this?
Well, okay, everybody, and I know this is real unpopular right now because our options are limited. However, if you are a citizen, and I am, and not a consumer and not a customer, guess what your rent is on this planet? You need to participate in the political process and you need to vote. Number one. And yes, I'm with you. Our options are limited. I wish we had a deeper bench too. But, there's a reason that president's title is commander in chief. So I get the frustration and feeling complicit and all the decisions and all that other stuff. But the seriousness of these times, we need to recognize that not participating in the process is not helpful. Number two, if we really wanted to improve health outcomes, and I need everybody to understand this at the population level, two interventions that we would do have nothing directly to do with health services provision. If we wanted to improve health outcomes at the population level in the United States, we would cancel student loan debt and we would have high quality, affordable childcare for everyone. If we did those two things, we would transform our society. Why, Dr. McLemore? Why do you say that? Well, if people were not beholden to working in careers because we have continued to tie employer-sponsored health insurance to where people work and they didn't have student loan debt, they would choose to work somewhere else. They would probably start new businesses, do all sorts of things if they wasn't saddled with debt. And I say this as a person who has no student loan debt. But I think we could unleash the creativity of humanity if we cancel student loan debt. If everybody had high quality, affordable and accessible childcare, whether you're a medical assistant or a janitor or a physician, we would completely transform how we work. And that would, again, spawn a whole new set. That's what people are afraid of. Why do you think we got all these abortion bills, but we still don't have no jobs bills? Why do you think we have all these different healthcare tweaks of SCOTUS, but nobody's talking about how to transform our society? Or when are we going to have a basic minimum income because our artificial intelligent overlords are going to get rid of all the jobs in the service industry, and yet consumer spending drives our economy? So I need people to write and call their representatives. They forget they represent us because we don't tell them what to do. I call them up every day. I be emailing them all because that's their job. Fund reproductive justice organizations. Make a donation. All of them got a donate button on the front page. It's the 30-year anniversary of reproductive justice. Get them $30. Teach a student about reproductive justice. Teach students how to detect the lies we've been told. Talk to young people. Listen to them. Hire them. Right? It's not rocket science, y'all. Sign on the amicus briefs. Agree to write expert testimony. Continue to push. We need also, at some point, I am hoping that somebody going to coordinate some marches or some sit-ins or some kind of civil disobedience in June. Because if we lucky, we're going to have an election in November and we have somebody already calling for a bloodbath and violence. How about some sit-ins? How about some civil disobedience? How about showing some collective, we're not going to take your threats. So as far as I'm concerned, there's a ton that's just not even active things that require you to spend money or to be harmed. Well, except for maybe the RJ donation part. Y'all should do that because it's 30-year anniversary, right? Go back to school, advance your education, get involved in the process. Remind people that working in repro is satisfying. It's not all doom and gloom and Chicken Little and I hate my job and oh my God. No, it is some of the most satisfying work I've ever done in my life. Stand on the side of the people that we serve and bring back dignity to their experiences. Pass the mic to them. How do you think we got where we've gotten so far in Texas and Alabama? Because people with lived experience have stood up and been like, no, this is not a thing, right? Tell the truth and change the future. That's what I was
saying. Oh my God. That's the perfect place to end.
Boom.
Monica, thank you so much for doing this. I had a wonderful time talking to you.
Same. And, I love the podcast. I'm glad that you're documenting these moments and allowing us to be myth busters because I'm just about done with being lied to. And I hope other people will appreciate that they're being lied to and act and behave different.
Okay, y'all. That was such a wonderful conversation. I'm feeling extra blessed and lucky to have had just two outstanding conversations these last 2 weeks. Like, I am always so grateful to all of my guests and think I get really lucky in having wonderful people on. But these last two have just been like above and beyond for me. And I'm just so happy to have had all three of them on. So yes, just so thankful. I hope you all have enjoyed them. And I will see y'all next week. If you have any questions, comments, or topics you would like us to cover, always feel free to shoot me an email. You can reach me at Jennie, Jennie, at reprosfightback.com, or you can find us on social media. We're at Repros Fight Back on Facebook and Twitter, or Repros FB on Instagram. If you love our podcast and want to make sure more people find it, take the time to rate and review us on your favorite podcast platform. Or if you want to make sure to support the podcast, you can also donate on our website at reprosfightback.com. Thanks all.